Types of disabilities.
For students that have ADD and ADHD, this is also known as attention deficit disorder and hyperactive disorder. There is neurological condition that could affect their attention, impulse control, controlling cognitive tasks, their motor activity, and social interactions.
For students who have blindness or low vision, there are different types of blindness or low vision. First, there's totally blind. Those students will usually use Braille or other non-visual media. And then there's legally blind, which means that person has a vision that's worse than 20/200, and they can only see 20 degrees at the widest part of their vision. And then there's low vision, which means that student has problems seeing things that are either far away or close to them, and they'll have difficulty with seeing something such as handouts or projected objects. And things that could be used to help those students are adaptive lighting or changing the print size, and in some cases using Braille.
Brain injuries. These are caused by different things. Accidents, insuffocated oxygen, so not enough oxygen going to the brain, stroke, poisoning, and infection. And this is actually one of the fastest growing disabilities between the ages of 15 and 28 years old.
For students that are deaf or hard of hearing, there's degrees of hearing loss. They can have low hearing loss, so just hard of hearing, or high hearing loss, which could mean that they're deaf. Now, if a student is deaf, they will call themselves, that they'll say that they are deaf because they see themselves as deaf. Different ways of communication for them would be reading lips, cued speech, sign English or American Sign Language, and not all speak, read lips, or sign.
There are also students who have learning disabilities. This is neurologically based and may interfere with listening, speaking, writing, reading, reasoning, or math skills. They can have average or above average intellectual abilities, and some just have problems with processing or expressing information. For these students, environment matters, and it could change how well the student does.
Medical conditions. These are caused from how they breathe to how much they get sick, neurological, and I don't know that word.
Circulatory.
Circulatory.
Some can affect more than one. This includes cancer, chronic fatigue syndrome, epilepsy, fibromyalgia, lupus erythematosus, MS, chemical dependency, diabetes, Epstein-Barr virus, HIV/AIDS, multiple chemical sensitivity, or renal disease.
For physical disabilities, a cause would be, these are congenital conditions, accidents, progressive neuromuscular diseases, such as spinal cord injury, which can cause paraplegia or quadriplegia, cerebral palsy, spinal defibula, amputation, muscular dystrophy, cardiac conditions, cystic fibrosis, paralysis, polio, post-polio, and stroke.
Psychological. So these are having problems with behavior or psychological problems like anxiety, mood swings, depression, and compressed assignment of reality. Behaviors will be radical or in cycles. Some do not respond or does not respond to care cases, and some may use medicine or therapy to control their difficulties.
Speech and language disabilities. Some causes are possible hearing loss, cerebral palsy, a learning disability, physical condition, and they could have difficulty with articulation and their voice strength.
Thanks for the help of Johns Hopkins University Office of Student Disability Service website.